Today on Lifelong Learning, we're focusing on what many see as the looming shortage of primary care physicians. The American Academy of Family Physicians has reported that we need as many as 52,000 more primary care physicians by the year 2025. So how likely are we to reach that number, and what are the issues standing in the way? What are some solutions to ensure we have the right coverage when we need it most? I'm your host, Alicia Sutton, and with me today is Ray Saputelli, Executive Vice President of New Jersey Academy of Family Physicians. Welcome, Ray. We are glad you could join us.
I'm delighted to be here. Thanks for having me, Alicia.
So let's start with an obvious question, that being what's caused the shortage. Some people might point to the Affordable Care Act and the projected 34 million people added to the ranks of Americans now with health insurance coverage. But in reality, that's not the only factor contributing to the shortage, is it?
Not only is it not the only factor, some could say it's not a factor at all. Those people who gained coverage through the Affordable Care Act, which as much as anything was insurance reform, is insurance reform at its outset. Those people still needed care. There were still people who needed care, albeit without coverage. So the primary care shortage is so multifactorial, but certainly the ACA, I never saw, and I don't think anybody who looks at the ACA sees it as necessarily contributory to the overall shortage. Certainly you'll have some situations where people come into the system with insurance and tax the existing system, but the shortage was there long before ACA.
Some of that shortage factors are aging population, growth in population. You see that in the concerns of your constituents in the academy?
Yeah, and so much of what that leads us to is such a need for primary care. Chronic disease, multiple diseases in patients. So as we age, as we are blessed by a system who manages to keep us around longer,
Indeed.
We're around longer, but perhaps we fight more chronic conditions that, frankly, continue to tax the primary care system, because the primary care physician and the family physician is really on the front line of the treatment of those chronic diseases. Let's
talk about some issues from the medical student's perspective. What is it about primary care as a specialty that might be issues for them?
It's funny because when you talk to a medical student, and I won't say all of them, but so many medical students that I talk to clearly believe in primary care, are drawn to medicine because they want to care for patients and care for the whole patient. And then our system chases so many of them away. And it chases them away on a bunch of different levels. They see what they interpret to be a challenging lifestyle. They see difficulty with the financial burden of being a primary care physician in this current environment, in our fee-for-service environment, where they come out of medical school with often more than $200,000 in debt. And our fee-for-service system doesn't really allow them to meet that burden with the lifestyle that they want. And then on top of that, they come out of the academic medical center where they're told, either, and I love this, you're either too smart to be a family doc or you're not smart enough. You'll never master. Why would you want to master all of that information? Or, you're too smart to do that. Either way, that toxic environment chases them away. And frankly, we don't hold the medical institution accountable in any way to produce the kinds of physicians that our society really needs. And I think that's something we're going to have to look at as a society.
Do you think graduate medical education, GME, is going to change based on this issue?
Well, that's kind of above my pay grade, but I'd love to think that as legislators look at how we spend money on graduate medical education, it's pretty clear that it's misaligned. It's pretty clear that, again, we don't hold the system, the academic medical centers, the medical schools accountable in any way to produce kinds of physicians that we're going to need going forward. And I think the American Academy of Family Physicians, just a couple of days ago now, released some information that they produced in conjunction with the Institute of Medicine that calls for a kind of radical change to the way we fund GME. And I would suggest that folks who are interested in that topic take a look at that proposal and think about, what it means. Because, on its surface, it can be a little bit scary whenever you talk about changing anything. There's lots of horses in that race. They have, stakes in the game. And people will be challenged to really think through why that kind of change is necessary. But I think at the end of the day, it is. I think it's necessary.
You've mentioned legislation a bit. Doesn't ACA afford for some growth in the primary care workforce, funding for education, funding for community health centers? Is that something you're aware of?
Sure, it does. And in fact, through programs like the Comprehensive Primary Care Initiative, which in New Jersey we happen to be very involved in as one of the regions for the CPCI program. And in fact, our whole state is a region in New Jersey Academy of Family Physicians, very active in helping practices who are part of the CPCI initiative. That initiative makes an effort to work towards the triple aim by really changing the payment model, right? And moving us away from this traditional fee-for-service model. So it's there. These system changes are a part of the ACA, but everything is still very much in its infancy. And I think we're still in a position where we know what good looks like, and we're trying to figure out how to get there as a society, right? We know where we want to be, and I just think we're trying a lot of different things to get there. And certainly the ACA affords some of that, but I don't think anything is as clear as you'd like it to be yet.
You're listening to Lifelong Learning on ReachMD. I'm your host, Alicia Sutton, and with me today is Ray Saputelli. He's the Executive Vice President of New Jersey Chapter of the American Academy of Family Physicians. And we're talking about the potential shortage, the projected shortage, a significant one, of primary care clinicians down the road. So there are some solutions that we can talk about, and I would like to, but, it's an interesting point here is that we see an increase in family medicine as an area of interest for medical students. So something's happening. Something is pushing them toward that. But talk to us about the solutions you see to help fill the gap.
Medical students, by definition, are smart people, right? They understand, I think, the need. And as medical students, I think they're often able to answer that very altruistic part of their personality to say, there's a need. And at the end of the day, family medicine, primary care, offers a medical student so many opportunities to explore and to learn and to serve their patient and to provide care. I think they see the excitement in that, and they often are exposed, for as much as we talk about, medical students being exposed to role models that maybe aren't the best. So often I see medical students exposed to family physicians who say, it is tough to practice family medicine right now. It is a challenge, and I do it again. And that kind of positive role model does pull people through the system. I'm always energized when I get to talk to medical students who really believe in what they're doing and have that fire. We all wish we could get that fire back in ourselves, right, for something.
Exactly.
And when you see that fire, it's incredibly engaging and invigorating. That said, they are smart people, right? And so the way I think we need to capture those medical students who really see primary care as an opportunity and are saying, I'd love to do this. I'd love to go into family medicine. Show me the path. Show me how to do it. Maybe we have to find a way for a primary care physician to come out of medical school without a mortgage, right? Without a $200,000 to $250,000 or more in debt. Maybe we need to show them an opportunity or the potential for the kind of system reform that will allow them to really practice to the fullest extent of their license, to practice, in a team that provides real difference, real change in a patient's life. Maybe we need to show them a system that is value-based rather than volume-based in the way we pay for care. That would change so much. It would change so much. So I think there's a lot of potential solutions, and I think if you you can find them anywhere. If you go out to AFP.org, NJFP.org, if you're in the healthcare community, you know all these answers anyway. And if you're not and you're interested, go to those websites, take a look, read, get active, talk to folks, and ask the question, are we getting what we pay for? Mm-hmm. Are we getting what we pay for? Are we providing the right care at the right cost at the right time and getting the best outcomes for the money, right? That's right. Ray's version of the triple aim. It's not the way, Don Berwick might say.
Yeah, but it's insightful. It's very insightful. What about, the patient-centered medical home? I mean, as more of these come up, obviously primary care is central there?
Primary care is, of course, central to the patient-centered medical home. The patient-centered medical home is foundational to so many things that we do. We talk about ACOs, and we talk about the need to coordinate care across the continuum of care for patients. At the end of the day, to me, what the patient-centered medical home offers is the ability to build a system that's based on the value that primary care brings, that's based on, as opposed to the volume, how many times I can, put my hands on you or leave a scar. And that's not to say that that's a bad thing. I have scars. I needed them, right? But it's so foundational. And if we're going to change the system, if we're going to change the outcomes that we provide in this country, and I think people are often surprised at the low side of the quality that we sometimes provide in our system, particularly, in chronic disease management. I think the patient-centered medical home offers a foundation for team-based care that will really help those patients who are most in need and who are often the biggest drivers of cost in the system, right? I think that's where the sweet spot is. We can call it patient-centered medical home. We can call it, the primary care medical home. We can call it, whatever you want to call it, but it's that foundation, that center of care where you and I know that today there is somebody that's going to help me through the system. That's going to coordinate my care, that's going to make sure I get the right care at the right time, at the right cost, all those things.
Right. Tell us about NJAFP, what's going on over in your offices and with your members.
NJAFP is a hotbed of activity. We love what we do. Everybody on our team is incredibly engaged in helping family doctors. My children are older now, but when they were young and they'd say, "Daddy, what do you do?" I say, "Are you a doctor?" Well, no, I'm not a doctor. I forgot to go to medical school. But every day I help family docs, family physicians, be the best family physician that they can be, whether that's through our advocacy efforts or whether that's through the work that we do in practice transformation and helping to coach practices along. We've coached probably almost 500 practices in New Jersey and across the country in everything from, becoming patient-centered medical home recognized to really transforming and changing the way they deliver care, and every stop in between. We're really excited about the work we're doing there. We're excited about the work we've done on the Comprehensive Primary Care Initiative, and here in the education that we provide. We provide education to family physicians across the country, and I think that's valuable.
I think it sounds exciting. I do indeed. So, Ray, let's look out on the horizon a little bit, say 5 years from now. If we put into action now some of the ideas that you mentioned and others have brought to you about making it a more enticing specialty, where do you see us going in about 5 years?
I'd like to be real Pollyanna, right, and say 5 years from now, if we do all these things, it will be great. We'll save money in the system, and people will get the care they need at exactly the right time, and our quality will go through the roof, and our cost will go through the floor, and maybe 5 years from now we're not there. But maybe 5 years from now, primary care, family medicine is really an attractive specialty for medical students to consider. Maybe every person who deserves a quality family physician in their life can have one. Maybe we're there. As one of my favorite friends in the New Jersey Academy, I'll mention him by name, Dr. Zlotnick used to say, in this country, we spend more and more to get less and less so that we can die sooner and sicker. Maybe that won't be the case.
Let's hope not. Let's hope we can look forward. I appreciate all your time today, Ray. Thanks for your insights. It's been great having you.
Thank you. Thank you very much for having me.
You've been listening to Lifelong Learning on ReachMD. I'm your host, Alicia Sutton, and I want to thank our guest, Ray Saputelli, for joining us today. Thanks so much for listening.